Resident doctors adamant. This is coming from the Punch newspaper and a couple of other dailies this morning. The federal government has mandated all chief medical directors in teaching hospitals across the country to open attendance registers with a view to stopping salaries of doctors taking part in the strike called by the National Association of Resident Doctors. Now, the order, which was revealed to newsmen by a senior health official, was also confirmed by the president of NAD, Dr. Oyilawa. Now, what's your take as regards this headline? Do you think this is the next step the government is supposed to take as tackling the strike between doctors?
Now needs all hands to be on deck, and we all need to really improve on our approach to governance. You know, like I always say, governance is not about only the people who are in office for a specific period of time. It is also about the people who are being governed. It's a collective duty. Therefore, when a situation arises in a democratic setting, you can never take away the discussion factor. If there is at any point in time a breakdown of understanding, you must always find a way to get back to a round table of discussion. The moment you take away that part, then you are giving room for the unpleasant inevitable, which is people going the way they deem fit is right at a point in time. The thing is, you see, I was reading the statement credited to the Honorable Minister of Labour yesterday, and then he made mention of having meeting with the resident doctors and some time ago, and after about a week or two, they embarked on a strike, and he had other things to attend to, and he wouldn't be attending to their meeting. So the thing is that the resident doctors are not charlatans, and they are not people who, they are core professionals, well-trained professionals. And I think that if at any point in time, whatever they felt they've agreed upon, like, you know, we do not have details of that agreement reached, but the point is that imagine resident doctors with different degrees, with different qualification, with different affiliation with professional bodies, both local and international, having resolution to embark on such strike. It means that something was fundamentally wrong in the implementation of the agreement that was reached initially. So I think what the government need to do in a situation like this is not to move towards coercing people to work, because if you say you want to open register and you want to invoke the no work no pay law or rule, then it means that you are trying to coerce people to return to work as against implementing the agreements that has been reached in your previous meeting.
Well, sorry to cut in. Who is not competent here now? Oyilawa is blaming Minister of Health, that's Olanrewaju, and also the Minister of Employment and Productivity, that's Dr. Chris Ngige. And both ministers are blaming the resident doctors.
Well, I think it is like this. What they need to do is call them to a round table. There is no, you see this discussion thing, it will always continue. It is something that you must always deploy. It doesn't matter if you've held a discussion last week or you've held discussion last 2 weeks. So far as there's a possibility of a breakdown of understanding, you need to call yourself back to a round table of discussion. It is not about who is right or who is wrong. That would amount to playing blame game. But at this point in time, we already know that there's already a breakdown of our understanding. And the only thing that can happen to amend the situation is to have an understanding, and that understanding can only be achieved when you come to a round table of discussion. So as long as the situation remains the same, then we have a big problem, because it is only the people who are the masses and are getting sick and are needing medical attention, going to medical facilities and in healthcare centers, that we really suffer the brunt, you know. So the situation is not a win-win for anybody. It's a lose-lose, because the government is losing, the resident doctor is losing, the masses are losing. So we have to look at it from that point.